You are watching Australian Medical History. At the Mater, for the first time in Australia, a robot is used to perform brain surgery.
We can proceed with the surgery quicker and safer. So we inserted 13 electrodes deep within the brain today in just under 2 hours, whereas in the past that would take 4 or so hours.
This is the Mater's Fabulous Four, part of a medical team now doing things for Queenslanders never done before.
First time in Queensland that that patients with refractory epilepsy can undergo this procedure called stereo EEG.
After endless tests, the pair were eventually diagnosed with a functional neurological disorder.
These are very disabling disorders. These are life-changing disorders that stop people from working, stop people from functioning in society, functioning as part of the family.
He's now set up a clinic at the Mater, one of only 2 in Australia, to help treat the condition.
I was given a diagnosis of functional neurological disorder.
Alex, you're a neurologist and you only recently started treating Miranda. Can you tell us what functional neurological disorder actually is?
It's really a group of disorders, and the hallmark features of that, these are genuine, real disorders with genuine, real symptoms, but no organic cause can be found for them.
Gerhard Infante is a new man. While physio appointments are still painful, this was unthinkable 3 months ago. There was no relief until the Mater Private Hospital and a team of surgeons volunteered to perform deep brain stimulation.
I think it's very rewarding, that's for sure, to see such a dramatic change and improvement in his quality of life.
I would hope that we give him at least another 10 years of good quality life.
It's called a stereotactic EEG. It's where doctors insert electrodes into a patient's brain, allowing them to target the exact place the epilepsy occurs, meaning surgeons can remove the affected part of the brain with precision.
Compared to in the past, where success rates for these sorts of surgeries when you didn't really know where the epilepsy was significantly low and you wouldn't really perform anything.
Peter Upton was the first patient to have the surgery in Queensland.
It felt like almost as if I was in a coma for the 5 years. After the operation, I've just felt incredible.
These are Rhonda Hodges' first steps after being housebound for more than a decade.
And when I saw my toes bend, I thought, yes.
Mrs Hodges was diagnosed with stiff person syndrome at Brisbane's Mater Hospital. In an Australian first for the condition, she had a pump inserted in her spinal cord to administer a drug to manage her symptoms.
The step forward here has been to push that envelope wider to deal with this condition. Labels that are inappropriately attached to patients and diagnosis are sometimes very hard to shift, yet the world is full of rare disease.
A team of 40 doctors and nurses performing life-changing surgery on a 24-week-old in utero baby. Until now, patients were treated after birth or had to travel overseas for in utero surgery. But doctors at Brisbane's Mater Hospital have successfully performed a procedure pioneered at America's Vanderbilt University. While it isn't a cure, doctors say the improvements are significant.
It should offer this child and other children a very real chance of having a better level of functioning than they would have had otherwise. These children with spina bifida can't process that brain fluid, and that's why we have to then put in shunts to drain it from the head down into the abdomen. The techniques are the same as doing it when the child is delivered at or near term. The quality of the tissues is quite different. The skin is much thinner. It's almost like sewing wet bits of tissue paper together, and you've got to be very careful and gentle with the tissues